Hi, I'm Virginia from Right Clinic, and here with me today is Lindsay. Lindsay is a medical writer and medical editor and the owner of MedWriter Bootcamp. Thank you so much for being here today, Lindsay. So let's start with the first question. What do you do and how did you get into it?
Right. So for me, I basically do two main things. So first is my day job. So I work at a fairly large medcoms agency, and I work as a medical writer and also as a medical editor. And this medcoms agency really tends to specialize more in sort of like the educational side of things, so educational medical writing. And it's a very, I would say, digital forward agency. So we do a lot of things like apps, we do games, we do animations, and a lot of like websites, things like that, but then also sometimes like VR experiences or AR experiences. So there's a lot of really exciting sort of projects we get to work on, which is really, really cool. And the second sort of thing that I'm doing is that I started a company last year. So I launched a company called MedWriter Bootcamp, and basically I'm just helping people get into the field of medical writing. So essentially to help land their first role, and it's specifically in medical education writing. So not things like regulatory writing, specifically the medical education side of things. And yeah, it's been going really well. It's very new, very fresh, but I've had about 20 people through the program, and people are starting to get work. So it's awesome. I'm very, very happy about that.
Awesome. Congratulations on the launch.
Thank you.
So, how did you get into medical writing? How long have you been doing this? And what is your kind of favorite type of medical writing to create? Because you mentioned apps and things like that.
Yeah. So how I got into it, I imagine a lot of people that you've spoken to sort of found their way into it accidentally. It's kind of a little bit of a hidden field still. I know it's sort of people know a little bit more about it now, but it definitely was much more of a hidden field when I sort of started. And I totally stumbled into it by accident. I do not have a medical background, so I don't have a medical or even really a science background. I did anthropology and visual studies in university. And then I graduated straight into the recession, so I could not find any work. And then I realized that, okay, I need to go back, I need to sort of beef up my skills in something. And I picked publishing. So I did a publishing certificate. That's where I sort of formally learned how to do editing, how to do writing. And then I worked in publishing for a while, so textbook publishing. And then I sort of branched out on my own as a freelancer for a while, but I really didn't have a niche at all. And this is something that I really realized, okay, you definitely need a niche in order to make a career, right, as a freelancer. And just totally by happenstance, I worked with this an agency, recruitment agency sort of thing. They put me in a placement at a very large medcoms agency in Toronto. And I was absolutely floored. I had no idea that this was an entire line of work. And I walked in and there was literally an entire, like a bunch of pods of editors. And there was about I would say 10, 15 editors. And this was like mind blowing to me because I had been struggling to find editing work. In general, sort of editing work, and here there was all these editors working, and so that's sort of how I started. I started on the editorial side of things, and then branched into writing. And someone else, a friend of mine who was also in that publishing program, she also got into medical writing at a different agency, and she sort of pulled me over into that agency once she heard that I had been doing this sort of work. And so yeah, and I'm at that same agency since. So it's been about 6 years, I think, 6 years. And yeah, I absolutely love it. Very, very cool line of work. And like you said, we work on all sorts of different things. I'd say for me, I really love patient writing. So I sort of carved a little niche out for myself as the person who specializes in sort of empathy-driven pieces, so patient pieces written for patients, but then also written about patients. So it would be things like tools that healthcare practitioners would use to get a better understanding of what a patient might be going through or how they might be experiencing a certain disease or progression of a disease, that sort of thing. And I really love that sort of work because you get to do a lot of deep dive research. I'll read all sorts of things about that disease from the perspective of people who have it. And then sometimes we'll even do interviews with patients as well, which is really, really cool. And I would say the most sort of exciting project I was on was I've done a few VR pieces. So these are for sort of conferences and things where mostly healthcare practitioners who are there, they'll come up to a booth, they'll put on a headset, and they will, in this experience, they'll experience the world as though they had a particular illness, right? and just a lot of fun, a lot of really interesting sort of work goes into creating that.
That's really interesting. I like the idea of a virtual reality or VR headsets and kind of experiencing what a patient experiences. So then you can really kind of empathize what they're going through and also have that ability to communicate with them better and whatever you're trying to, advise them or give them any kind of information to help them with their health. So that's really interesting to hear because I haven't heard of that before. So that's news to me. So thank you for sharing that. And it's really interesting that your friend kind of poached you from the other agency that you're actively in. I think, once you know people, it's a very small space and you do kind of build a circle of people around you that you're more comfortable to work with. So that's really funny to hear. And it's really nice actually to hear that you've been doing this for 6 years, which is longer than me, which is great. And it must mean that you really like it. And it's also testimony to a lot of people ask this question, which is, do I need to be a healthcare professional or have a medical background or know science in order to do medical writing? And so here you go. Lindsay is proof that you don't. So you can make it. And I always encourage people who just are really interested in writing about health or medical topics that they can still get into it. So thank you for being here and sharing your story and giving people that confidence to kind of, just go for it. So what would you kind of advise yourself if you could go back in time to the very beginning to give yourself a kind of head start?
Yeah, so I think for me, the biggest thing is that, I wish that I even knew this was a field, 7 years ago or whatever. I could have given myself a 5 to 7, year head start. But obviously you learn things as you learn them, right? So there's no use in that. But I would say, for people who are just sort of coming up and they're looking for their first role maybe, or even a transition into a second role, something like that, one of the things that I think will really help people out, especially if they're interested in this line of work, so like the medical education writing piece in particular, is to understand about instructional design, learning theory, and sort of more that educational, like the educational theory that goes into creating these sorts of projects. Because I'm actually seeing more and more when I'm looking at different job ads and things like that, sometimes like people are just looking for that. They're looking for that sort of expertise, or at least that you have some sort of awareness of that sort of thing in some of the requirements. But also I'm even seeing that some people, like a client who I work with, her job that she ended up getting, it was something like medical writer / learning lead, something like that. So they're even, the titles are even changing, right? So sometimes you might be able to get medical writing work where the title might not even specifically be medical writer, because they're talking a little bit more about that like educational side of things. And so, this instructional design is called different things, right? Curriculum design, instructional design, learning theory. To have at least a bit of a background in that, I think, is really important. And that's something that I would have done. I probably would have taken a course in that. You can even just read books in that. And if you have any sort of projects where you have pulled in any of these sort of theories, so just to give your audience an example of this sort of thing, there's lots of theories that come into this, but it would be things like chunking down content and sort of shortening content, putting a lot of like paragraph breaks in there, making things much more digestible and easy to understand, and even like changing your language, because I think this is one of the things that new writers sometimes struggle with a little bit. If they're coming from academia, they're sort of really used to the academic style writing, right? But it doesn't, in medical writing, it shouldn't be that academic. It needs to be understandable and much more almost immediately practical, like that people can sort of pull this into their practice and use it like quickly often, right? So sort of shifting things to make them more digestible. Also things like self-assessments will be in there. So, you're learning this information. It's not just about giving the information. It's really about people understanding it, digesting it, and then retaining it. And part of that is maybe doing some self-assessments in there. So you might have to write like almost like mini quizzes and things like that in some of the information that you're giving. So just having an awareness of curriculum design, I think, is a really important thing. And I really do think that would help out applications. If you write that in your cover letter, your resume, you at least have an awareness of that. I think that will really help people out.
That's really helpful to know, because that's also something that's new to me. Medical education is not something that I've done before. And I would be interested to know what your main audience is. So you said you're kind of really interested in patient information. That's kind of what you specialize in as your niche. And so is there medical education for patients and also medical education for healthcare professionals? Are there other audiences too, or are those two the kind of the main ones?
Yeah, I would say that those are the two main ones for sure, and then sometimes also for healthcare or sorry for caregivers as well. So healthcare practitioners, caregivers, patients. I think those are the main ones. But even the sort of like instructional design sort of component to things really will help out for all of those audiences, right? Not just for the patients, but also for HCPs, for healthcare practitioners, because if you're doing, let's say, a disease awareness piece or something like that, sometimes the people who are, consuming that information will be quite aware of it, quite aware of, that particular illness, but sometimes they might not, right? And so it's not good just to assume that everybody has, all sorts of specialization in every area of a particular disease or even a particular treatment for a disease. So even that idea of sort of simplifying language, that can actually be really helpful for healthcare practitioners as well.
Yeah, I think that's a really good point, because I've also found that even, business communicating with businesses, that the more easy it is to understand what you're saying, the more likely they are to actually action what you're trying to get them to do, which is, to either learn something or change a certain behavior or something like that. So that's really interesting to hear. I think there's, if you have the time to spend on your writing, then think about making it as simple and direct as possible so that it's more accessible to more audiences. So thank you for sharing that. So what's next on the horizon for you? What are your future plans?
Yeah, so for me, I'm working full time at my agency, and then my next big thing is basically is MedWriter Bootcamp. So that is still sort of going on in the background. My next intake is in May, and yeah, I'm very very excited about it. I'm basically doing a bunch of marketing over the next couple months to try to sort of get the word out there, get people understanding what exactly I'm doing and what the course is all about. And yeah, we have some fun things as well in the course. Like I'm doing sort of book giveaways, so like writing craft book giveaways and things like that in our little course community and things like that. But yeah, I'm excited for the next cohort.
That's really exciting. Well, I wish you all the best with your next cohort. And it sounds like you're doing really great and helping lots of people to get into medical writing and medical education writing, and helping patients through your writing as well. So I think sometimes we get really caught up in the idea of being a medical writer that, ultimately we all have the same purpose, which is to help patients and other audiences with their health, and also to empower them to help patients if they're a healthcare professional, for example, with their health as well. So keep up all the great work that you're doing, and thank you for listening or watching. And I will leave links in the description below so that you can follow or connect with Lindsay on LinkedIn, and then also check out MedWriter Bootcamp as well. So thank you so much. And
Thank you.
thank
Thank you so
you.
much, Virginia.
We'll invite you again in future for sure. It'll be lovely to see how you progress with MedWriter Bootcamp and everything else that you're doing.
It sounds wonderful. Thank you so much.
All right. See you soon. Bye.
Take care.